Well, hello, and thanks for joining my video on the adrenal and thyroid drugs. So the endocrine system is a very fascinating system. We know that the endocrine system has many different glands that are part of this system that is responsible for so many activities in the body. Um, think it is responsible for maintaining internal homeostasis, keeping everything really in the body running well. There's a lot of different glands in the endocrine system taken from this figure in your book, from the brain, the hypothalamus, the pituitary, the adrenal glands, the sex organs, the ovaries, and the testes. We are going to be focusing in this discussion on mostly the adrenal glands and the thyroid. So we know that the adrenal glands are these little tiny glands that sit on top of each of the kidneys, and they are responsible for producing hormones. And we're really looking at the cortex of the adrenal glands, not the adrenal medulla, the inside of the adrenals, but on the outside layer of the adrenal glands called the adrenal cortex. So this is called adrenocortical system that we're looking at. But the hormones that are produced here that we're going to be discussing are cortisol, which is your stress hormone, and aldosterone, which is responsible for your fluid and electrolytes, your blood pressure balance. So looking at the first hormone that is released by the adrenal glands is cortisol. And what is cortisol? It is your stress hormone. So we know that when there are times of stress, when you are injured, when there's inflammation, that stress hormone cortisol gets released. So if you have a patient that is in need of some extra stress hormone, cortisol, you can think of two different types of patients that would need that. One would be if a patient has adrenal glands that are not functioning. We call this adrenal insufficiency. There's a variety of different reasons why this could happen. It could be an autoimmune disorder like Addison's disease, which causes the destruction of the adrenal glands. It could be a brain tumor that is affecting the hormones that also affect the adrenal glands. It could be a variety of different things. Don't worry so much about all of the different types, but think about that as one different category. So the patient has adrenal insufficiency, their adrenal glands are not able to make this stress hormone. So your body needs this on a daily basis that's secreted in what we call a diurnal pattern. But if this patient has adrenal insufficiency, they will need a daily dose of cortisol. And cortisol, the synthetic version, think of it as a steroid or like a prednisone. Now, there's many different types of cortisol synthetic medications, but for your list, we're talking about prednisone. And think about anything that ends in sone, S-O-N-E or O-N-E. And different steroids that you may recognize are fluticasone, um, hydrocortisone, prednisone. All of these are steroid anti-inflammatory drugs that are going to help that patient. But if a patient has adrenal insufficiency, they're going to need that daily dose of steroid hormone. The other type of patient that you may want to think about is someone who does not have a chronic need for prednisone, but needs it on a acute basis. And that would be, say, for someone who has an acute inflammation. We know that asthma is an inflammatory disease, or you're learning that asthma is an inflammatory disease. And sometimes when the asthma gets so bad, there's so much inflammation in their airways, they need an anti-inflammatory that can relax that redness in the lungs decrease in inflammation and help the patient breathe. So a lot of times patients are given what we call a burst of steroid, a burst of prednisone, where they're just given 5 days worth, and that's enough. It does the trick. Another situation would be like a very bad skin reaction that is very inflamed. The patient would get an anti-inflammatory or prednisone. We know that on a short-term basis, it really helps with inflammation, but if you're using prednisone on a long-term basis, say a patient has a chronic inflammatory disorder, they may need to have a regular dose of prednisone. We know that it can affect their ability for them to heal wounds because it suppresses that immune system, it relaxes it. So for these patients that are on this chronic amount of prednisone, we do not want them to get live vaccines because they are considered immunosuppressed. And we don't want to stop that automatically. It needs to be tapered. Very important, pens up. Because what happens is the adrenal glands get used to this exogenous prednisone or the pill of prednisone being given. So it is, the adrenals are suppressed. So you need to give that a little bit of a chance to get kicked back up and secrete its own cortisol. The other pens up is prednisone or long-term glucocorticoids can increase the chance of fractures. It does significantly affect the bone-forming cells, so it can have an increased chance of fractures. So here's a case study. A 16-year-old is seen in the ED for a fracture of the radius. Their past medical history, the patient has had asthma, 5 episodes or exacerbations per year since age 2. The patient has had multiple fractures, 5 in the last 2 years. What is the priority when providing patient or parent teaching when discharging this patient? Well, what do you think is going on? Well, again, as we just discussed, when patients have asthma, we know it's an inflammatory disease. They should have those bad exacerbations prevented by taking a daily inhaled steroid medication like a beclomethasone. But some patients do not for a variety of reasons. Either they're not prescribed the correct medicine or they don't take the correct medicine, but they're left with this life-threatening acute exacerbation of asthma, and it's too late to start the inhaled steroids, so they need to take this burst of steroids. Again, as we discussed, this repeated use of glucocorticoids can affect the patient's ability to maintain their strong bones, and they can have increased fractures. So we need to educate this patient on following up with a respiratory specialist to make sure that they do not continue to require these big steroid bursts. The next hormone that the adrenal glands secrete is a mineralocorticoid called aldosterone. And remember that aldosterone is the hormone that's responsible for sodium and water retention and potassium excretion. So it helps maintain the blood pressure and the fluid and electrolytes. Patients, again, as we discussed, that have adrenal insufficiency, let's say they have this autoimmune disorder and their adrenal glands are not functioning, they need a daily dose of a synthetic aldosterone. And one of these medications is called fludrocortisone. This is an adrenal replacement for aldosterone. So if we think about this, let's put it in a case study. A patient is started on fludrocortisone for adrenal insufficiency. What potential side effects would the RN watch for? Well, we know that the aldosterone is going to help with sodium and water reabsorption to keep the fluid balance adequate and their blood pressure. So if they're retaining sodium and water, and always think of the main adverse effect as too much action. So if you have too much water and too much sodium, how would that patient present? Right, they're going to be fluid overloaded. They'll be edematous. They'll have weight gain. They may have heart failure because they have too much fluid. It's too much for the heart to pump out. They may have pulmonary congestion. You may notice crackles in their lungs. Great job. And potassium excretion, so too much, if they're peeing out too much potassium, then their serum potassium is going to be low. Very good. We would want to tell this patient to increase their foods that are rich in potassium. The thyroid, the next gland we're talking about is the thyroid. It's this little gland that sits on the trachea, and it's responsible, again, for a lot, mainly metabolism, growth, temperature. So the hormones that this thyroid gland produces are the thyroid hormones, and we refer to these as T3 and T4. Now, your thyroid stimulating hormone is the hormone that will tell the thyroid how much thyroid hormone needs to be produced. So thyroid stimulating hormone will be increased when the thyroid levels are low. So hypothyroid, think low, hypo, low, hypo, slow. What is this patient going to look like? Things are going to be slow. So decreased metabolism, decreased weight gain, weight gain, fatigue, constipation, cold, or their body will be cold. They'll have a slower heart rate. What will their blood labs look like? Well, again, their thyroid hormones will be low, so you'll see a low T3 and T4, and your TSH will be high because it's going to be trying to stimulate the thyroid hormones. Thyroid replacement for patients who are hypothyroid is called levothyroxine, which is T4. It will help speed up that metabolism. So again, in your case study, what would a patient look like if they were getting too much thyroid replacement? Think too much action. So they would look more hyperthyroid. They would be jittery. They would have weight loss. They would be hot. They would have diarrhea. Everything is going too fast. So hyperthyroid, if a patient is hyperthyroid, think hyper, things are fast. Increased heart rate, sweating, hot, nervous, diarrhea, weight loss. What will their labs look like? Well, they will have a high thyroid level, so high T3 and T4, and their TSH is going to be low because it does not need to stimulate more thyroid hormone. Treatment for hyperthyroidism can be used using propylthiouracil, we always call it PTU. It is the treatment for hyperthyroidism that isn't used as much as it used to be before. There are different medications that are used as well, but it blocks the formation of the thyroid hormones within the thyroid. Adverse effects, think too much action. So you're going to be hypothyroid looking, drowsy, decreased heart rate. Also, iodine is used to treat hyperthyroidism. Iodine is needed for thyroid function, but high doses block thyroid function. So radioactive iodine is taken up in the thyroid, and then the radioactive part destroys that piece. Again, adverse effects, think hypothyroidism. Contraindications are pregnancy and drugs with a small margin of safety, such as anticoagulants and digoxin. Thanks so much.